But now we will hear from Evie, my dear friend and member of the Alliance Board of Directors. Her presentation is titled The IMPACT ALS Survey Comparison of EU and US data. Evie.
Hello, I'm Evie Reviers, CEO of the ALS Liga Belgium. Today I present you the IMPACT ALS Surveys with a focus on a selection of US and EU data. This presentation is given on behalf of the IMPACT ALS EU Advisory Committee, and the study was sponsored by companies mentioned here. The slides were prepared by Apatocom and previously presented to the FDA in 2019 and to the EMA in June 2021. This slides give you an overview of the IMPACT ALS Europe Advisory Committee, of which I am a member, and our partners. As already mentioned, the companies Cytokinetics, Biogen, and Oinus provided funding for this study. A selected number of their employees provide specific disclosures. The presentation consists of 3 parts. Part 1 shows you an overview of US and EU ALS surveys. Part 2 gives a brief comparison of the US and EU data at a glance. And finally, Part 3 sets an outline of next steps for a more in-depth analysis of the data. Let's start with a review of the study methodology. The goals of both the US and EU IMPACT ALS survey are the same: quantify and improve understanding of the functional burden of disease, ensuring that both the patient and caregiver voice is heard. By delivering robust evidence for the burden of ALS from patient and caregiver perspective, and while ensuring scientific publications that creates impact for regulatory review of new therapeutic options. The US version of the IMPACT ALS survey was launched in October 2017. Recruitment of participating patients and caregivers was conducted via the channels of ALS chapters NEALS, CREATE, TDI, and CDC Upon Western. 3 years later, in October 2020, the IMPACT ALS survey was also launched in Europe via the channels of a select number of national ALS associations and through EUPALS. However, the US and EU versions of the survey contained some differences in terminology to adhere with alterated terms in the 2 continents. We now come to the core of the presentation. What are the demographic and disease characteristics we observed? And are there differences between the US and EU? First of all, it was striking that both in the US and in Europe, a very similar amount of patients as well as caregivers and bereaved caregivers participated in the IMPACT ALS survey. However, as the participants were not obliged to provide an answer to every specific question, we obtained different numbers of respondents to individual questions. Also, the age distribution and gender ratio was very much alike between US and EU participation groups. Some differences in the employment status of the US and EU participants were, however, observed, pointing to a higher employed rate of European participants and compared to those in the US. Even more, the time since formal diagnosis almost perfectly in line between the US and EU participants in the IMPACT ALS survey, as shown right here. At first glance, the number of sporadic ALS cases involved in the European study is significantly lower, but this gap must be filled by the higher don't know cases reported by the European respondents. Overall, we can state that the study population of the US and EU IMPACT ALS survey are very comparable. The next few slides give you an overview of how ALS patients themselves or their caregivers experience severity of the disease. Within the group of caregivers, a subgroup of bereaved caregivers is selected. In the IMPACT ALS survey, bereaved caregivers is the European definition for informal carers that assisted a loved one that is passed away. In the US version of the survey, they are defined as caregiver past. When asked to score a range of symptoms of ALS in the last 2 weeks before the survey, fatigue and weakness in the limbs received the highest response. Furthermore, it is striking that US caregivers score all symptoms as more severe than experienced by the ALS patients themselves. Even more, the subset of US caregivers that lost their loved ones score several of the symptoms even worse than the caregivers that assist an ALS patient that is alive. Also within the EU participants, the symptoms fatigue and weakness in the limbs received the highest scores. In general, the assessment of the symptoms by European caregivers and bereaved caregivers is also worse than by the patients themselves, with exception of the symptoms fatigue and weakness in the limbs. This slide shows you the assessment of the stress level experienced by US-based ALS patients or their caregiver during the last 2 weeks before taking the survey, or by caregivers or ALS patients that are passed away during the last 2 weeks they provided care. Overall, we observed a higher stress level reported by the caregivers relate to the ALS patient, with the highest stress levels reported by caregivers of patients that have passed away. Similar results were obtained in the EU IMPACT ALS study. Also here, caregivers reported higher stress levels than ALS patients, with the highest stress levels reported by the bereaved caregivers during the last 2 weeks that they provided care for their loved one. This observation that stress accumulates in caregivers with the maximum amount observed in the final stage of caring is an interesting top-line result that further needs to be analyzed more deeply. Next, the IMPACT ALS survey asked ALS patients for their fears about the future. About 70% of the US patients indeed responded to have such fears. By far the biggest fear is the emotional worrisome of leaving their family too soon, followed by the medical anxiety of dying by respiratory failure and the financial worry of spending too much of the family savings for their care. In Europe, also about 70% of the patients responded to have fears about the future. And also here, the biggest fears are related to family situation, the possible cause of death, and financial consequences of their disease. In another subset of the IMPACT ALS study, participants were asked to score their priority for approaches to treating ALS. First, patients, their caregivers, and bereaved caregivers were asked to indicate the most prominent difficulties that ALS patients encounter with everyday tasks. In the US IMPACT ALS survey, difficulty with doing things around the house was scored the highest, followed by difficulty with picking up things and execual, difficulty using arms and hands, and difficulty getting dressed. The EU IMPACT ALS survey has very similar results. Also, European patients, their caregivers, and bereaved caregivers ranked the difficulty doing jobs around the house as highest, followed by difficulty using arms and hands and getting dressed. When asked for the preferred symptoms of treatment should have an impact on, US respondents scored above all, stop the progression of ALS. This was closely followed by the impact on breathing, respiratory function, and almost ex aequo by mobility and muscle weakness. Exactly the same top 3 preferences were indicated in the EU IMPACT ALS study. Taking the US and EU data together, this clearly indicates that the top priority should be a therapy that stops progression of ALS, followed by closely a treatment that has a positive impact on respiratory function and on muscle weakness that affects mobility. In conclusion, the IMPACT ALS survey conducted in the US in 2017 and in Europe in 2020 obtained very similar information on disease experience by more than 3,000 respondents. This rich source of data allows for further international comparison. To do so, an analysis plan is in place for targeted data mining. We are convinced that these data will be at most useful for treatment and drug development. I thank you for your attention, and I'm eager to take your questions.
Can I ask you maybe both that did you get a response from everyone, every country in Europe and every state in the US?
Hi, good, John. Thank you. Good question. So I can speak more for the European data than the US data. So I should sort of, as maybe a jumping off point for the questions, we should say this is the comparison of sort of top line data. So we haven't got into it in huge amounts of details just yet. So obviously the European survey was done much more recently. So we are actually just at a top line level with our analysis plan in place for the European data at the moment. And the plan is ultimately to work through that analysis and then to go into a detailed comparison of the US and European data. So I think from memory, the US data, which again, I'm less familiar with, was quite representative of the population spread across the US. So less responses from least populous states. In Europe then, we had a variable response, and that's you've hit the nail on the head with a very relevant matter that we need to really cover in the analysis. So we had quite a disproportionately high response from Italy. So one of the pieces of our analysis is to actually strip that back and see why it was so high in Italy, and probably getting on for a third of the respondents were from Italy in total. We had varying degrees of response then from the other, so there was 9 participating countries, and so we had varying degrees of response. We had quite a relatively poor response in the UK, a relatively poor response in Germany, but a very representative response in Ireland and Belgium and the Netherlands. So it's something we need to build a bigger picture on and delve into a little bit more, but it's something that will definitely be included in the analysis. And then that comparison across the Atlantic, I suppose, is really, really important as well, because there's no point in saying we have answers on representative populations if we can't speak to how representative they are. So it's something we're certainly mindful of as we jump into it in more detail. So that's a long-winded way of sort of saying we need to know more about it. So it looks quite good on the European side, and I think it is quite good on the US side as well. But it's something that I think it's a lens we need to describe as we present the data. I think it's a very, very important one.
And if I can just add something to that, I think it's very important because we have now the International Alliance meeting that for the European data, it would be very important to also have the Eastern countries involved in it. And because we know a lack of knowledge about organizations in there, it would be good if somebody know them, that they can mention their address to us or giving us address to them, that they can participate in this.
Yeah, absolutely. It's so different from one country to another in Europe, and as we all know, and in US, I believe it's even more difficult to compare, because there we have individuals with insurance and not with insurance, so on. But it's a good start, and I know we will ask this again.
Exactly right, good John. And we actually ask about insurance as well. It's something that we have, so we haven't looked into that just yet. But what I was actually struck with, if I might just reflect on the top line results, is how similar Europe and the US look, which I find kind of heartening, to be honest. That's good, but I think there has to be areas of difference, and I think they are likely to revolve around insurance. So I think when we get past the top line, we are likely to see that for sure. And as to Evie's point, I think the nature of the survey means it's very repeatable, replicable across different jurisdictions. They're very general kind of lines of questioning, and we are actually interested to get these responses from ALS patients and caregivers around the world. I think there's nowhere that it's not interesting to know that about. So definitely.
Yeah, and I think in Europe, that's also something we need to keep in our mind, that the difference in the healthcare systems across Europe is also a fact that people are not attending the survey because they have it good. So that's maybe something we need to figure out also in this impact study.
Yeah. But can you read the comments or the chat? Because we have a lot of questions, their ideas, and respond as you wish.
Yes, I see a few questions. Can you please share the plans to publish this data is one?
Yeah.
Yeah.
We're in the process of that at the moment. I think maybe the best way to flag that at the moment, and jump in if this isn't a sufficient response. Our first paper that we hope to release is actually a general one, which will describe these top line results in Europe now, not the comparison with the US, but we'll describe the top line European results, and we'll also plot the course for the analysis. So that's the planned first publication. So I think that will probably be the presentation of those that publication plan. So I think that will mark that. So we hope to have that paper ready in the next couple of months. That's the timeline for that.
Okay, and then I have a comment of Norman. This confirms the burden of caregivers, and this study is very useful as it offers concrete data to confirm this. Yeah, I think this is something clearly that came out of the analysis of the study. And then we have another one of Kalanit. Given the survey was done in the US in 2017 and world events in 2020, do you think it is a value to revisit the US data and see if the stress levels have changed?
I think so. I think world events in general, as we're all sadly well aware, we'll be very mindful of them in our European analysis. I suppose, you know, it's one of those things. In Europe, people took this survey during COVID. So yeah, obviously it could affect stress levels. People in the US took it pre-COVID. So even just the world events at the time they took them will be quite different. So I think the most way we'll be mindful of that, and we're definitely open to doing some further work or some extension work on the US side of it if it's warranted for it. But I think what we'll use to signpost that is maybe the likes of where we find stark differences. We won't write them off as just, oh, that's obviously COVID. I think we'll kind of take that as an indicator that maybe, okay, we have a little asterisk on that finding. There's quite a difference here. We maybe need some further data from the US. So I think we'll be mindful of that, and we'll use it to signpost kind of where we might need further information if there are stark differences.
And then I have a question of Jan. Do you think that it would be a good idea to take Asia also in the survey next time? And at the other topic he sent it, and Africa, of course, if possible.
I think I've kind of covered that a little bit already, and it's a relatively simple answer in that, yes, I think there's a couple of points to it, I suppose. At the first level, you know, a lot of it's very general information that we're looking for, and it's of interest. There's not really any country in the world that it's not of interest from, or any region in the world that it's not of interest from. I think there is probably an appetite to do this again in Asia. That would be driven by the sponsors, but I think there definitely is an appetite for it, and in Africa as well. As Evie said, there's the kind of general information, and then there's understanding that general information through the lens of the more complex information. So, you know, we can get that general information relatively easily, but to understand it, we maybe do need to do some work on the kind of complexity of the systems that we're dealing with. So even in Europe, we've looked at 9 countries, for instance. We could have looked at 29 countries, I suppose, in Europe, and they'd come with, you know, subtly different systems. Well, subtly different in some cases, and quite different in other cases. So yeah, there's kind of 2 levels to it. To kind of, I think the general picture is very much of interest, and it's useful in itself. Then to maybe understand that to a greater degree, we probably need greater complexity in the questionnaire. So there's a bit of give and take in it, or there's a bit of a cost benefit analysis, because I suppose if we make the questionnaire too long, you know, people can't possibly be expected to answer it as well. So the simple answer to the question is, though, yeah, I think we would definitely like to roll this out to other jurisdictions and other regions in the world, especially somewhere like Asia would be quite different from Europe again. So it might be nice to get even just that top line difference to see how, if at all, that differs from Europe and from the US again. So definitely very interesting.
And then I have another point from Wendy Abrams. Thank you both. This also seems to indicate that most responses came from limb onset patients rather than bulbar, since mobility was a high portion, followed by respiratory, knowing respiratory applies to both.
Yeah, I think that's probably right. And I think that probably speaks to maybe the breakdown of the numbers, the breakdown of the types of onset. We probably need to, it's another thing we need to look into as we're going further into it, but I suspect it does reflect the breakdown of people with ALS and the types of symptoms they have, and just how numerous each are, I suppose.
And then I have another question from Kathy Cummings from the Alliance. Can you explain the cumulative burden concept?
You've stopped me in my tracks, Kathy. You've caught me with a question that will be absolutely perfect for my colleague Miriam Galvin. That's absolutely her field of expertise. But she was meant to join us today, but unfortunately she wasn't able to make it. But that's very much her side of things, Kathy. So I might actually loop her back to you on a back channel on that one, because I'm not going to embarrass myself by trying to explain that one. It's very much her area of interest and of expertise. So apologies for that.
And then another question was also that the data seems very similar from the US and the EU. What differences, if any, are there, have surprised you?
Yeah, good question. As I've kind of mentioned to date, the top line show very much the similarities and not the differences. So that's what surprises me, how similar they are. And I think just the brief exchange Gudjon and I had, I expect there will be some degree of difference around things like health insurance, but that's speculation at this point. We haven't actually got into it. So on the top line, they're very, very similar. So that's the most surprising thing is how similar they actually are. So yeah, I suspect when we break things down more by people with ALS's perception of things in the US versus in the EU, and then caregivers, when we just pull it apart a little bit more, I suspect we will find those differences, but they're not apparent up front, which again I take as kind of a good thing. It maybe is less interesting, but it does show the need for international collaboration, because a lot of us are dealing with very similar issues the world over, which is reassuring to show that international collaboration is so valuable.